Hey guys, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. Thanks again, as always, for joining me for one of these quick study episodes here to give you some key content to help you pass exams. We're going to continue on today with respiratory emergencies. This is going to be a little bit longer than some other ones that I've done because I'm going to try to get into some of the pathophysiology and assessment findings when we talk about respiratory emergencies. Before I do that, of course, I always like to talk about why this stuff is important. Now, of course, I always say these are key content that's going to help you pass your exams, right? Because there's a lot of the stuff you're going to see on almost every exam, especially major exams. But it's not just for exams. It's also geared to help you build your knowledge base, to make you better at doing your reports, to interacting with other healthcare professionals like doctors and nurses, and to get you making better clinical decisions, right? Now, of course, these are quick tips. These are key bullet points of this content. So if you don't understand it, then of course, I encourage you to go ahead and crack open that textbook. Use a resource like paramedic.com or the main website at EMS SEO, and go ahead and delve deeper into the content that we're talking about today. So let's get into it, guys. Talking about some respiratory emergencies and pathophysiology. Now, we talk about the things that affect gas exchange, right? That ventilation, right? And we talk about upper and lower airway obstruction, things like trauma, epiglottitis, tonsillitis, patients that are choking, obstructive lung disease, mucus, bronchospasms, edema of the airway, okay? All these things that are problems that can affect gas exchange. And then you get your impaired chest movement. Again, trauma, your hemothorax, your pneumothorax, even pus that can be building up that can affect the movement of the chest, right? Being able to breathe in and out and expanding and contracting your lung muscles, right? And then we have our neurological control problems, depressed CNS functions that can be caused by things like, of course, drugs, right? If they're, opiates and things like that, but also things like stroke and other diseases that can cause neurological issues when it comes to your respirations. Now, I want to talk a little bit about diffusion and perfusion, right? But talk about diffusion first, and the problems can be coming from low oxygen in the air, alveolar pathology, things like blebs and COPD, interstitial space pathology, right? High water pressure or edema, okay? That can all be diffusion related problems, giving the issue of the oxygen exchanging in your lungs and in your blood, okay? And what about perfusion related problems? Well, we'll talk about some quick things here, which is inadequate blood volume, right? Of course, if you don't have enough blood to get the oxygen to your tissues, that's going to be a problem. Low hemoglobin levels as well. Impaired circulation is going to be an issue as well. And also, of course, we always go back to the trauma, and chest wall trauma can also be an issue as well. Okay, so again, guys, basic high points for diffusion and perfusion. If you're not getting some of this stuff, crack open that textbook, delve a little bit deeper so you can maybe understand a little bit more when we talk about low hemoglobin levels and how that can affect the perfusion aspect of respiration, okay, and why that can be an emergency. Okay, I want to go over some assessment and the findings you're going to get there, guys. Now, this is a wide, kind of, field here, right? You can have everything from altered mental status to use of accessory muscles to patient being unable to speak in full sentences, tripod positioning, tachycardia, all the things that you can look at here, right, to kind of lead you along the fact that there might be a respiratory issue going on, okay? Of course, some of them are obvious, right? Cyanosis or absent breath sounds, it's a respiratory problem, but maybe that altered mental status could be an issue because of a perfusion issue going on, right? Or the tachycardia might be your only indication sometimes that there might be some sort of respiratory or perfusion issue happening and that you have to go ahead and deal with. And remember, we always want to, we go back to the ABCs, right? And we always want to go ahead and focus on recognizing those life threats first. Okay, so we want to also, when we talk about our assessment, is thinking about things like our focus history. Okay, some things you want to ask patients. Have they ever had this type of a problem before? Okay, they might know they have asthma or COPD or something like that. Okay, or even if there's some recent issues happening, maybe they recently diagnosed with pneumonia. Okay, or with bronchitis or something like that. Okay, so find out if they have any of those things. Do they have those known respiratory problems? Have they ever even been intubated before? That's an important question to ask, because your risk of them kind of turning on you to the kind of the negative end of that might be more likely. Okay, and find out the medications that they're on. Okay, what kind of respiratory medications are they on? All right. And are there any changes in those medications? That could be a factor as well. And keep in mind, like I said, if you get a patient that might be recently diagnosed with pneumonia, and they might not realize that they were diagnosed with that. They went to the doctor because they had a cough or something, but then they have an antibiotic that they were just recently, administered, and that can lead you on the way of knowing what's going on with that patient. And don't forget to think about that general impression too, guys. Okay, what is the patient's positioning when you're looking at them? Are they tripoding, like I had mentioned before? Okay, and when they are in a tripod position, that usually means they're kind of in a moderately severe respiratory distress situation. You want to go ahead and address that. And then we talk about mentation, their ability to speak, like I mentioned as well before. Can they speak in full sentences, only one or two words, and not able to speak at all because of the breathing is so difficult for them? Okay, and what's their effort? Okay, are they taking shallow breaths, deep breaths? Okay, are they breathing rapidly? What's their skin color? What's the appearance of their skin color? Okay, all these things sort of tie in just your general impression when you're doing your history on these patients, and you're getting into your focus history and kind of taking a kind of a more global view of what's going on with the patient. So I want to wrap it up, guys, here and talk a little bit more about some other things just to look at real quick. Of course, you want to do your vital signs. You want to get their heart rate. You want to get their pulse. Um, is it strong? Is it weak? Things like that, right? Their blood pressure. And you want to, again, note their respiratory rate and their patterns, okay? Are they breathing too fast? Are they breathing too slow? Is it regular? Is it irregular? Is it deep? Is it shallow? All this type of stuff. Lots of stuff to think about, right? When we talk about respiratory emergencies, okay? Because sometimes it might not be that evident to you right off, but as you assess the patient, things will kind of come into focus a little bit more if you think about this as your sort of that global view when you're checking out that patient. Okay, what about their head and their neck? Okay, maybe they have pursed lip breathing going on? Maybe you see some JVD. Okay, and again, talking about that infection, that sputum. Okay, they tell you they are coughing up sputum. What color is it? Is it white? Is it yellow? Is it green? Is it brown? Is it bloody? Right? All the things that sort of tie into that. And then, of course, their chest. Are they breathing equally? Is everything moving the way it's supposed to, right? There's no sort of asymmetrical type breathing. You want to see if it's symmetrical when they're breathing. Okay, again, we always want to note the trauma just in case, right? And that barrel chest, looking for COPD history, and also the having any type of retractions when they're breathing as well, any type of accessory muscle use. Okay, all the stuff that's kind of take a step back and look at. Okay, their extremities can be a clue as well that there is something going on. Are they cyanotic on their extremities? Okay, or they're having something called carpal pedal spasms, where they get that they're breathing too fast and they get that low CO2 levels. Okay, all the stuff that's going to tie in to kind of lead you along the path of what you need to do and how to treat these patients and further your assessment when you're doing it. And don't forget the diagnostic tools that are available to you. Okay, and oxygen saturation or your SpO2 levels, okay, are a key indicator that something might be going on with that patient. Okay, depending upon where you are, most guidelines state that 94 or above is okay for the patient, right? But below 94, take a closer look, especially if you get in that SpO2 reading and you've got a good waveforms going on, right? It means that it's reading it right, and it's low, and it's low for a reason. Okay, and don't forget your end tidal CO2 as well. Okay, if you have a patient intubated, or sometimes some places have the end tidal, the capnography sort of reading you can use with a nasal cannula. Okay, those are expensive devices. A lot of agencies don't use them because they do cost, but it can help you assess your patient, especially those COPD patients. Okay, and then we have peak flow as well. Not every agency uses that. There are some out there that will use peak flow readings to help with your diagnostic tools. To me, that's something that's kind of more advanced, not necessarily something that's needed in the field. Okay, because if you're doing that, you should be able to tell your patient is having a problem breathing or not without having to start doing the peak flow test. But your end tidal and your SpO2 readings, your oxygen saturation readings, are important tools that you can go ahead and use when you're assessing your patient. Okay, guys, that is going to be it for me today. Next week, we're going to continue on. We're going to get a little bit more deeper into some of the other elements of respiratory emergencies. We're going to start with that, with your asthma or your obstructive airway diseases. Okay, we're going to go ahead and do that next week. In the meantime, guys, please engage with me. I'm on social media. Okay, you can get me at Twitter or Instagram. I'm at EMS Safe on both of those social media platforms, or hook up with me on Facebook, and it's facebook.com/the EMS professional. Guys, if you have some time and you want to increase your knowledge more, or go ahead and get a leg up on a lot of the stuff that I'm talking about, go ahead and head on over to the main site. It's emsseo.com. The SEO stands for Success, Education, and Opportunity, because to me, I feel that when you are well educated and you have a good knowledge base, right, it's going to lead to more success. That education is going to lead to opportunities in the field. And it might just be a small opportunity in your agency where you might become a field training officer, or maybe a lead paramedic or something like that, okay? But it's still something that you need to do, and I think it shows people that you are engaged in the profession, right? Not just going along, when you are increasing your knowledge base on a regular basis. So if you need some help, you want to go ahead and drill down more into this content, okay, build that knowledge base, go ahead and check out the site. There's practice exams there, there's basic study help, and again, ways to increase your knowledge base. A lot of this stuff is free. Some of it is very low cost to get you, low entry to get you into some of these content that's there, okay, but all geared, again, to help you be a better EMS professional. All right, guys, again, that's it for me. If you have some minutes of your own, send them over to me. My email is contact@emsofficehours.com. Be sure to visit the main blog site at emsofficehours.com, and you can check out the previous episodes of the Monday Minutes, and of course the podcast. Take a listen to the podcast as well. I think you'll find some great interaction there as well. And don't forget, guys, leave me some feedback below in the show notes. Comment there. Go ahead and like it, share it, and let others people know about these Monday Minutes. All right. As always, guys, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.